Welcome, I'm Jan Kugel and this is another episode of Letters to Avoid, a series about GMP where we take a look at FDA warning letters and break them down. Today I will talk about mistakes you should avoid when maintaining your facilities and how to correct them if they already happened. As an example, we'll look at a warning letter received by the company OHM Pharma. OHM Pharma is a producer of homeopathic medicine. The company uses non-dedicated equipment to make different products that are used by children and infants. As I have already talked about in my other episode about homeopathy, manufacturers use toxic substances in the production of those drugs. Because of the toxicity, cleaning the facility between batches and products is crucial. When the FDA auditor visited the company's premises, he found white residue in hallways and rooms within the production areas. The areas were not in use at the time, but the operators marked them as clean. Not only that, but the company's operators couldn't even identify what the substance was. It could be anything. To avoid such situations, you must follow 21 CFR section 211-56. It requires that companies maintain buildings that they use during the GMP window in a clean and sanitary condition. The facilities need to be free of infestation by rodents, birds, insects, and other vermin. You have to dispose of any trash and organic waste matter in a timely and sanitary manner. If there are already such violations in your company, you need to do a complete evaluation of your cleaning program, which includes equipment and facilities. Likewise, prepare a comprehensive corrective action and preventive action plan. You will need it as evidence that you know of the problem and on the way to correct it. The CAPA plan should also include improvements to your cleaning validation program, as it unfortunately failed in the first place. If you found this video interesting, please share it and leave your thoughts in the comment section. That was all for today. Stay compliant and see you in the next segment.